Hi, my name is Sandra Pagenta, and I am a board-certified adult nurse practitioner. We're going to go over the Pediatric Clinical Specialty Booklet. The key takeaways you're going to learn in these videos are the specialized approach of the pediatric patient, how to obtain a medical history, completing a review of systems, performing a physical exam, and presenting a pediatric patient, as well as common health issues for the pediatric patient. We polled over 140 NPHub preceptors to create the most relevant pediatric information to create these booklets and videos. By the end of this time, you should have a baseline working knowledge to approach your pediatric rotation. Approaching the care of the pediatric patient is different from the care of the adult patient. If you have toddlers, then you know that children have a whole vibe. Nevertheless, from the moment you enter the room, make sure to address everyone to create a welcoming atmosphere. Parents bringing their kids into the doctor's office want to know that their provider is engaged and prepared for the age of their child. Creating a fun atmosphere can help the patient and family feel comfortable. Consider using age-appropriate communication techniques, such as play, drawing, and visual aids to engage the child. This will help facilitate their understanding and bring about their cooperation. Make it a point to always be eye level with the child and always be honest to keep rapport with your patients and their families. As the pediatric NP, start by considering a child's developmental stage when assessing their abilities. Be understanding of their fears and anxieties and provide appropriate activities and interventions. Use age-appropriate language and explanation when communicating, and the visual aids to help them understand medical procedures or concepts. Involving parents or caregivers in the care process is tantamount to your success as a pediatric provider. Make sure to use appropriate assessment skills, such as for pain, and consider non-pharmacologic methods, such as distraction techniques, comfort positioning, or guided imagery. Another key aspect of the care of the pediatric population is assessing growth and development. This includes monitoring of growth and developmental milestones, as well as immunization schedules. At each visit, it is incumbent on the NP to educate parents or caregivers about age-appropriate nutrition, safety measures, and developmental expectations. The pediatric NP should be prepared with clinical facts and thoughtful questions when caring for this special population. At the start of any patient visit, begin by introducing yourself and explaining your role as their provider. Create a comfortable and non-threatening environment to build rapport with the child and their caregivers using the techniques described in the last video. Obtaining a thorough history and review of systems are essential components of assessing the health of the pediatric patient. Start with the child's basic demographic information, including name, age, gender, and primary language spoken at home. Determine the primary reason for the child's visit, whether for a well child check or a sick visit. This will drive the rest of the appointment. Then ascertain the chief complaint in the patient's or child's own words. For example, we are here for a 12-month well child check. These visits require asking about how the patient has been since the last visit. Any other questioning stems from anything the parent or the child bring up. If the child is at the clinic for a sick visit, get a detailed account of the child's current illnesses or symptoms, including when they first noticed the problem, any recent exposures, and any factors that worsen or alleviate the symptoms. Ask about any treatments or interventions that the caregiver has already tried. Next, begin to collect information for the history of the present illness by using the OLD CARDS acronym to help gather as much information as possible about the patient's problem. For review, the acronym stands for onset, location, duration, characterization, aggravating factors, radiation, and temporal factors, as well as the severity using the pain scale. Be sure to use open-ended questions when going through the patient's history. Gather relevant medical history by including birth history and the neonatal history, past medical conditions, surgeries, child immunization status, and verify if they're up to date with recommended vaccines. Note if the child had any previous vaccine reactions. Inquire about any hospitalizations, allergies, environmental triggers, and current medications/allergies. Include information about the family's history, particularly focusing in on parents and siblings or hereditary conditions. Specific details like the relationship of the family member to the patient, the age of the diagnosis, and the age of the death are especially helpful. Use a family tree if possible. Inquire about the child's developmental milestones, such as the age at which they achieved motor, cognitive, and language milestones. Discuss any concerns related to growth, behavior, learning, or social interactions. Next, for the nutritional history, you want to know whether the infant is formula or breastfed and when solids were introduced, if vitamin supplements are utilized, and the appetite and diet of the older child. Continue with the social history with information about the child's living situation, family structure, and any recent stressors at home. The marital status of the parents and the parents' employment can also be included. Next, you want to ask about the child's physical activity, sleep patterns, exposure to tobacco or alcohol, or drug use. Ask the parents about the child's school performance, social interactions, and any challenges or concern. After obtaining the history, start by going over the review of systems. The review of systems is a systematic review of different body systems. The review of systems can be used as a way to inquire more specifically about a body system the child may be complaining about and to catch symptoms they may have forgot to mention. I will provide pediatric-specific factors when reviewing systems. For general review, be sure to assess the child's overall appearance, behavior, and activity level. Inquire about changes in weight, height, appetite, puberty, and sleep patterns. Constitutionally, ask about fevers, chills, fatigue, or malaise. For the skin review, be sure to note any rashes, itching, bruising, and problems with hair or changes in skin color. For head and neck, inquire about earaches, hearing difficulties, ear drainage, nasal congestion or discharge, and frequent nosebleeds. Be sure to mention if the child has a history of a sore throat, difficulty swallowing, or enlarged tonsils. Finally, inquire about any dental problems, the age of eruption of deciduous and permanent teeth or mouth sores. When reviewing the respiratory system, be sure to ask about any coughing, wheezing, shortness of breath, or rapid breathing. For the cardiovascular system, ask about any chest pain, palpitations, or fainting. Note any exercise intolerance or any limitations. In regards to the gastrointestinal system, ask about any abdominal pain, vomiting, diarrhea, or constipation. For GU, ask about any changes in urinary frequency, urgency, discomfort, bedwetting, urinary incontinence, or recent UTIs. Assess any concerns related to genitalia or menstrual cycle if applicable. Musculoskeletal factors include joint pain, stiffness, swelling, history of fractures, injury, any postural deformities, or changes in gait. Neurologically, be sure to ask about any headaches, seizures, tingling, or changes in coordination or balance. When approaching hematologic and lymphatic systems, ask about any bruising, lumps under the arms and neck, recurrent infections, or bleeding disorders. For this lesson, I brought my co-creator, Jackie, to help me go through the material. Performing a thorough physical assessment is a critical component of caring for your patient. It helps healthcare providers gather objective data about the patient's health status, identify potential health issues, and develop an appropriate treatment plan.
Before starting the physical assessment, ensure that the environment is comfortable, well-lit, and private. Gather all necessary equipment, such as a stethoscope, blood pressure cuff, thermometer, reflex hammer, otoscope, ophthalmoscope, and measuring tools. These items can be scary for children, so we suggest using kid-friendly items and introducing them in a fun way when examining the pediatric patient.
Certain age groups require a tailored approach to the physical exam. For infants, we recommend assessing the patient lying in the parent or caregiver's arms and leaving ears, eyes, and the mouth to the end and using the least to the most invasive approach. Assess the heart and the lungs when the infant is quiet or asleep, and try distraction techniques with older infants. Infants less than 6 months are best examined on the table.
For toddler-aged children, use minimal contact, allow inspection of your equipment, like the stethoscope, assess the heart and lungs, and then proceed with the head-to-toe approach. This approach also works well for preschool-age children.
For school-age children, the provider should make sure to respect privacy, explain the steps of the visit, and approach to the physical exam before beginning.
For the adolescent patient, the physical exam is similar to that of the school-age child. Be sure to explain physical findings, respect privacy, and ask parents to leave the room during part of the exam to gain rapport.
When starting a comprehensive physical examination, maintain open and effective communication with the patient. Explain each step, address any concerns or questions, and ensure their comfort and dignity. This will help with building rapport with your patient. Be sensitive to the patient's age and cultural background. Adjust the assessment techniques and communication style accordingly to ensure the patient feels respected and understood.
Begin the exam by assessing the patient's vital signs: blood pressure, heart rate, respiratory rate, and temperature, and general appearance, noting the patient's behavior and overall condition. Note any signs of distress, discomfort, or abnormalities.
Now it's time to perform the head-to-toe assessment. In this assessment, you will systematically assess each body system from head to toe. This typically includes the following areas. For the head and neck, inspect the scalp, face, eyes, ears, nose, mouth, and throat. Palpate lymph nodes and assess the range of motion of the neck. For pediatric patients, be sure to assess the fontanelle size, the eyes for the red reflex, and the mouth, noting the number of teeth present.
Moving on to the chest and lungs, auscultate lung sounds using a stethoscope and assess respiratory effort, symmetry, and any abnormal breath sounds.
For the cardiovascular system, auscultate S1 and S2 heart sounds and assess peripheral pulses, jugular venous distension, and edema.
For the abdomen, inspect, auscultate, percuss, and palpate the abdomen to assess for tenderness, organ enlargement, masses, and bowel sounds. Note that infants usually have protuberant abdomens that become more scaphoid as the child matures.
Musculoskeletal system. Observe range of motion, muscle strength, joint stability, and any deformities or abnormalities. In the pediatric patient, note any signs of lordosis, scoliosis, kyphosis, or sacral dimple. Additionally, physiologic bowing is often seen in children under 2, before spontaneously resolving.
For the neurological system, you're going to want to assess their mental status, cranial nerves, motor function, sensory function, reflexes, coordination, and gait.
The integumentary system. Inspect the skin for color, temperature, moisture, lesions, rash, and wounds. Assess skin turgor and perform a full body skin assessment, including the scalp, nails, and mucous membranes. Evaluate children for birthmarks, hemangiomas, and Mongolian spots.
For gender-specific assessments, evaluate the genitalia, perform a breast examination for females, and assess urinary patterns and function. Note the Tanner staging in the pediatric patient. For the gynecologic patient, a speculum exam is used as well as a bimanual exam to assess the vagina, cervix, uterus, and adnexa. Be sure to include a focused examination based on the individual's presenting concerns or symptoms. When documenting your findings, include pertinent positive and negative findings, abnormal findings, and any concerns or observations. Use clear and concise language, ensuring the information is organized and easily understandable.
Use appropriate terminology and include relevant measurements, abnormalities, and any subjective information reported by the patient. A comprehensive physical assessment should be tailored to the patient's needs and pertinent to the chief complaint. The pediatric NP will spend a large portion of her clinic time providing well child care visits. These are also known as well baby or well child checkups. The purpose of these visits is to promote the overall health and well-being of children by providing a comprehensive health care and preventative services. These visits involve regular checkups, assessments at specific intervals throughout a child's early years and beyond. The key objectives for well child check visits include monitoring growth and development. Tracking a child's growth and development over time includes measuring height, weight, and head circumference, and comparing them to standardized growth charts and identifying any potential concerns or deviations from the expected patterns. Providing preventative care. This means to promote optimal health and to prevent future problems by providing immunizations to protect against vaccine-preventable diseases, screening for early detection of developmental delays, hearing and vision screening, as well as discussions about healthy lifestyle habits, nutrition, and safety practices. Offering health education and guidance. Well child care visits provide an opportunity for NPs to educate parents and caregivers on age-appropriate milestones, discuss strategies for promoting healthy habits, address safety concerns, answer questions, and provide anticipatory guidance for upcoming developmental stages. Relationship with healthcare providers. Well child checks also play a crucial role in establishing a trusting and ongoing relationship between families and healthcare providers. Consistent follow-up builds rapport and allows for a continuity of care, as well as facilitating open discussion between parents and providers. This relationship enables healthcare providers to better understand the child's history and address concerns and provide personalized care. Early detection and intervention. Regular well child care visits help identify early signs of potential health issues or developmental delays. Healthcare providers conduct thorough physical examinations, assess developmental milestones, and perform screenings to detect any problems early on. This early detection allows for timely intervention, appropriate referrals, and implementation of necessary therapies or treatments. Providing support for parents and caregivers. By offering opportunities for parents and caregivers to discuss their concerns, seek guidance on parenting issues, and receive emotional support, NPs can address parental questions and offer reassurance, as well as providing resources or referrals as needed. We touch on developmental milestones for children from birth to 12 years old and older in our clinical booklets. They discuss the physical, gross, fine motor, social, and language development of children. Be sure to review that chart so that during their well child checks, you can be familiar with how children should be developing. It goes without saying that vaccines can prevent common diseases that used to cause serious harm or even death to infants, children, and adults. Without vaccines, children can be put at risk of becoming seriously ill or even dying from childhood diseases such as measles and whooping cough. These diseases are extremely contagious and can be very serious, especially for babies and young children. In recent years, there have been outbreaks of these diseases, especially in communities with low vaccination rates. Well child visits and recommended vaccinations are essential and help make sure that children stay healthy. When we immunize infants and children, we help promote herd immunity so that other people who have never had the disease, can't get the vaccine, or have a weakened immune system can also be protected. We have in our clinical workbooks the full CDC recommended immunization schedule for quick on-demand review. Please refer to our adult immunization video for more information on the vaccines and how they prevent certain diseases. For this lesson, I brought my co-creator, Jackie, to help me go through the material. Presenting a patient to your preceptor involves providing a concise and organized summary of the patient's relevant information. Remember, it's important to tailor the presentation to the specific needs and preferences of your preceptor. Present the patient information in a concise, organized, and focused manner so that the relevant information is conveyed effectively.
Here is a framework to use for presenting your patient. Present the patient's chief complaint and reason for their visit. Use the patient's own words if possible. For example, "I'm constantly urinating, doc." Provide the patient's basic demographic information, such as age and gender. For example, Tommy is a 75-year-old white male seen in the clinic with a new onset of urinary frequency, urgency, and dysuria for 3 days.
Present the HPI. Provide a brief chronological account of the patient's symptoms, starting from when they first noticed the issue. Mention any exacerbating or relieving factors, Include any self-treatment or interventions attempted by the patient. Remember to use old carts, as described in the previous videos. Then summarize the patient's relevant medical conditions, including chronic illnesses, previous surgeries, and significant medical events.
Highlight any medications the patient is currently taking. Examples include patient has a past medical history of diabetes, BPH, and HLD. Patient is on metformin 1000 milligrams BID, Lipitor 40 milligrams PO daily, and Flomax 0.4 milligrams daily. Make sure to share the patient's social and family history. Include relevant information about the patient's lifestyle and social factors that may impact their health, such as smoking, alcohol consumption, occupation, and living situation.
Make sure to mention any recent significant life events, changes in social support, or relevant environmental exposures. Mention any pertinent family history if applicable. Up next is the pertinent symptoms or findings from your review of systems. Focus on the areas related to the chief complaint.
Next, describe the key findings from the patient's physical exam. Make sure to highlight any abnormal or relevant findings that may guide the diagnosis or management.
Once completed, share any diagnostic test already performed, including the results and their relevance to the patient's condition. Follow up your assessment and plan by offering your evaluation of the patient's current condition and differential diagnoses.
Outline the proposed plan for further investigations, interventions, and management. Include any specific questions or concerns you would like the preceptor to address at this time.
And once you're done presenting your patient, be prepared to engage in a discussion or answer any questions the preceptor may have. We'll first start with the most common pediatric problem, constipation. Constipation affects up to 30% of children and accounts for 3 to 5% of all visits to the pediatrician. Peak prevalence is in preschool, with 95% of cases being due to functional constipation. Functional constipation is the result of painful or unpleasant experience with defecation that the child wants to avoid. Symptoms include difficult, infrequent, or incomplete defecation without evidence of an anatomic cause. Constipation is defined using the Rome 4 diagnostic criteria. 2 out of 6 symptoms need to be present, such as stool frequency, hardness and size, fecal incontinence, stool retention. Symptoms should be present for 1 month in infants and toddlers and 2 months in older children. On physical exam, the pediatric NP will find abdominal distension and fullness. Treatment and follow-up include a bowel cleanout and then maintenance program. The NP can recommend certain dietary changes as well if needed. If disimpaction is needed, start with an oral or rectal med such as stool softeners and stimulants. Examples of these are Docosate, which can enhance water in stools, and Senna, which can stimulate intestinal motility, but use the latter medication with caution as it can cause dependence. Enemas and suppositories cause bowel distension and produce an evacuation reflex. Next to discuss is acute otitis media, which is an acute infection of the middle ear space associated with inflammation and effusion that translates to ear pain. It's worth noting that if the pressure from the effusion is evacuated via perforation or an ear tube, a child may present with no pain and only ear drainage. The most common culprit for otitis media is Streptococcus pneumoniae. Risk factors for acute otitis media include smoking or secondhand smoke, bottle feeding, pacifier use, daycare attendance, and children younger than 3. Symptoms include ear pain, drainage, headache, a muffled or blocked ear, preceded by an upper respiratory infection. On the physical exam, the nurse practitioner might find a TM or tympanic membrane that appears bulging, erythematous, cloudy, with a middle ear effusion, and the impaired mobility of the tympanic membrane. The perforation might be present and should heal quickly. Observe children younger than 2 with mild signs and no ear drainage for 48 hours. Treat children with amoxicillin younger than 3 months at 30 milligrams per kilogram per day, and older than 3 months with 80 to 90 milligrams per kilogram per day, twice a day for 7 to 10 days. and lean towards the 10 days for older than 2 or severe infection. Acute otitis media implies the rapid onset of disease associated with one or more of the following symptoms. Correct. The answer is D, vertigo. Vertigo is not a common finding for patients with acute otitis media. Question number 2. Michael is a 3-year-old boy who presents to the pediatric clinic for persistently worsening constipation over the last 3 months. His mother is at her wit's end and is concerned that his refusal to defecate will lead to fecal impaction. She has tried prune juice, but still notices he doesn't have a normal defecation pattern. The pediatric NP wants to calculate the patient's Rome criteria. Which of the following is not a requirement for functional constipation in children? Good job. The answer is D, blood in stools. That is not a requirement for constipation in children. All right, so that's a wrap. I'm so glad you took the time to watch these videos so that you can be the best NP student your preceptor has had come through their doors. And don't forget to check out nphub.com to get access to all of our specialty notebooks. Reviewing these notebooks before and during your rotation will help you lay a foundation for a truly rewarding learning experience and maybe even a potential job offer down the road. Good luck.